What changes can individuals make when it comes to their diet and food consumption? Especially, what can we as doctors do to influence the patients that we have the privilege to look after?
Yes, well, diet, of course, is absolutely crucial, a major determinant of non-communicable diseases, as we know. Our current diet in many Western countries is unsustainable, quite high emissions of greenhouse gases. As you referred to, livestock, particularly ruminants, is an important source of greenhouse gases, and they produce methane, which is a powerful, relatively short-lived greenhouse gas with an atmospheric lifetime of about 12 years, something of that order. So reducing our consumption, particularly of meat, of ruminant-related products, meat and so on, red meat, is an important part of constructing a more sustainable diet. But also, most of us don't eat enough fruit and vegetables and other nuts and seeds and legumes and so on. So it's not just a question of reducing our consumption of, say, red meat, but it's also a question of increasing affordable access to fruit, vegetables, nuts, seeds, other healthy plant-based foods. And in doing that, we can reduce the environmental footprint of our diet quite substantially. A study that we did in the UK suggested that if we could optimize the UK diet to meet WHO guidelines, that would reduce the greenhouse gas emissions by about 17%, something of that order on average. And would also extend life by on average about 8 months, something of that order. So there would be big health benefits. And we're not talking about radical changes in diet here. We're talking about, relatively modest changes of eating more fruit and vegetables and less red meat and other animal products. And so you can go even lower than that. You can reduce greenhouse gas emissions by about 30 to 40% by more dramatic dietary change. But once you go to very extreme levels of reduction, then of course the diet starts to deviate from the normal and may become less attractive. And there's a lot of interest also in innovations in the food systems. So, we're seeing a whole range of new types of food, everything from cultured meat to mycoproteins like corn and so on. Some people are experimenting with insects, growing insects for food, either to feed to animals or directly to humans. So there are a whole host of innovations, sometimes called cellular agriculture, which may transform the food system in years to come. We still don't fully understand all the environmental impacts of these novel foods, but it's a very active area of research.